A very warm greetings to everyone. Myself Pranaya Kalimbu, and today I will be talking on the topic foreign object found in X-ray. So foreign object detection is an important part of diagnostic radiology. It involves identifying any object inside the human body that does not naturally belong there, such as toys, plastic items, glass, or metal. These cases are most common among children who may accidentally swallow or insert objects, but can also occur in adults due to accidents, injuries, or medical procedure. Let me begin with my case study. The case is based on a patient who came with abdominal discomfort with a routine X-ray revealed an unexpected foreign object in the abdominal region. The radiographic findings showed a distinct radio-opaque shadow indicating the presence of a metallic object. During image interpretation, we observed that the shape and density were consistent with a metallic foreign body, possibly ingested accidentally. The radiograph was taken in anterior-posterior view, which clearly outlined the object against the surrounding soft tissues. In this type of case, our role as radiographer involves several clinical steps, ensuring the patient is positioned properly, selecting correct exposure factors, and confirming the radiation protection measures are strictly followed. Once the image is taken, the radiographer checks the positioning, contrast, and density to make sure the object is visible and interpretable. In some situations, a lateral view may also be taken to locate the exact depth or level of the object. After identification, the radiologist and the clinician together decide on management, whether surgical removal or observation. So this case demonstrates how X-ray plays a crucial role in both detection and treatment planning. So to connect theory with practice, I referred to a textbook by Pinto et al. Titled Neck Soft Tissue Foreign Bodies. So this chapter explains that when a foreign body So, when a foreign body is lodged in soft tissues like the neck, it can cause infection, inflammation, or tissue damage if not removed. The text highlights that imaging techniques are essential to locate the exact position of the foreign body before attempting surgical removal. It states that radiographic evaluations are routinely performed to confirm the presence of radio-opaque foreign bodies such as glass, metal, or stone within the soft tissues. So it also points out the limitations of X-ray that radiolucent materials like plastic or wood will not always be visible in those situations. Other modalities such as CT or ultrasound may be used. So So the key learning here is that radiography not only helps confirm the object presence but also guides the safe removal process. It reminds us that every imaging step is clinically significant, especially when surgical precision is required. So next, I will discuss the research paper titled Utility of X-ray in Identifying Utility of X-ray in identifying non-metallic foreign bodies. The main aim of this study was to determine how useful X-ray is in identifying non-metallic objects and to assess the arrangement among radiologists in detecting them. The researchers first conducted focus group discussion with nurses, fellows, and attending physicians to list common objectives that children might accidentally swallow or insert. So they selected 12 items including clay, crayon, plastic bead, Lego piece, paper clip, eraser, and a barrette. These were embedded in a gelatin slab placed over a water equivalent phantom to mimic the density of a child's abdomen, creating a realistic sim- simulation for radiographic testing. X-ray were then taken, and five experienced radiologists who did not know how many or which objects were included were asked to identify them based on the images. The study found that metallic and dense materials such as paper clips and glasses and glass bricks were easily identified by all observers. However, non-metallic and low-density materials like clay, crayon, and plastic bricks were much harder to detect, and interradiologist agreement dropped significantly for those objects. This clearly shows the limitation of X-ray when it comes to radiolucent materials. The study therefore suggested using CT scan or ultrasound when X-ray results are not clear. So another interesting outcome was that experience level of radiologists played a role. Those with more exposure to pediatric imaging had slightly higher detection accuracy. The researchers also analyzed inter-rater reliability using the kappa coefficient and found moderate agreement overall, indicating that visual identification alone can vary among experts. In so conclusion, the paper emphasizes that while X-ray remains the first line imaging tool, it should always be interpreted carefully, considering both object material and clinical symptoms. The authors recommended maintaining proper exposure settings and ensuring optimal image contrast to improve detection changes, especially for faint, non-metallic foreign bodies. Overall, this study provides valuable insight into how imaging protocols can be improved to enhance early detection and patient safety. So now, now I will be showing a YouTube video titled Approach to a Foreign Body on Chest X-ray. This video clearly explains how radiologists identify and analyze foreign bodies seen on X-ray.
So now we'll be discussing a very specific aspect of chest X-ray, that is approach to a foreign body on a chest x-ray, whether it's ingested or aspirated. So when you're seeing a foreign body, which we've already talked about, that the density of the foreign body, particularly a metallic foreign body, would be much higher than that of the bones. So that is how you pick up a foreign body in the first place. Once you've picked it up, to localize it, whether the child, most commonly a child will be presenting with a foreign body, so whether the child has ingested it, that is, it is lying in the esophagus, or it's lying in the trachea, the child has aspirated it. So as you know, chest x-ray is a frontal projection. It's a 2D representation where the trachea and esophagus will be lying in the same plane when looking at it from a PA view. So on the frontal projection, there is no way to know if you have a centrally projected foreign body.
So as the video begins, you can see a normal chest X-ray being reviewed. The presenter highlights a systemic approach starting from the soft tissues, airway, and bony structure, and then looking for any abnormal opacity or density. This helps in avoiding missed
Whether it's lying in
findings.
the esophagus or trachea. So the trick to find out is that the esophageal foreign body, that is an ingested foreign body, will be lying end face, as we are seeing in this particular image, that we are seeing the complete disc here, that is the foreign body is end faced, suggestive of its esophageal location, suggesting that the child has ingested it. However, in the case of airway location of the foreign body, what we will be seeing is a sagittal plane. So the foreign body will be lying in the sagittal plane, and the most common site of it being stuck would be the right main bronchus, as you can see. So while the esophagus has constrictions near the aortic arch, it will be here higher up where the normally location of the trachea is there, while a airway foreign body will be lying in this particular location where we have the right mainstem bronchus, because it has a vertical and a straighter course, allowing a foreign body to pass into it and getting lodged there. So these are the two important tricks. You look at the shape of the foreign body and you look at the location of the foreign body, and the easiest way is to do a lateral x-ray to confirm. So on the lateral x-ray, we have these two structures separated. So as we can see, this air-filled structure, darker structure, and the anterior structure is the airway, and the posterior structure here will be the esophagus.
So here we can see example of foreign objects in the airway and chest. Notice how metallic objects appear bright white while plastic or other low density materials look faint or shadow-like. The video also shows the importance of taking two views, which is AP view and a lateral view, to locate the object more precisely.
If you have the foreign body located posterior to the air-filled airway, it is esophageal in location or ingested foreign body, whereas if it is lying in the airway or the blacker structure, that means the child has aspirated it.
So, the presenter also explains how to differentiate two foreign bodies from artifacts such as overlapping shadows, medical tubes, or external items. That reminds us that accurate diagnosis depends on careful observation and experience. So, in summary, this video gives a clear and structured method for identifying foreign objects on chest X-ray by observing their density, shape, location, and relation to anatomical structures. It reinforces how radiographers must always combine good technique with critical thinking. So now I will be showing my lab demonstration related to the topic foreign object found in X-ray. Good morning everyone, my name is Prerna and today I am presenting a lab demonstration on foreign object detected on body. In this video, I will explain how X-ray helps detecting foreign object in body. So here you can see our X-ray unit setup. The main purpose of this demonstration is to explain the basic components, positioning technique, and the role of radiographer in identifying foreign bodies through X-ray imaging. So here we have an X-ray unit which is So this is the X-ray machine which is used to produce radiographic images. Used for producing radiographic image, and this is cassette where the patient is positioned above the cassette and it captures the image. And here we have a lead apron which is used for radiation protection. And all these are essential components for safe and effective images. So here I have shown the cassette which holds the image receptor, which is known as image receptor, or it it holds the film where the X-ray image is captured. We always make sure that the cassette is clean, correctly placed, and positioned according to the area being examined. So next you can also see the lead apron, which is an essential essential radiation protection tool. It is worn by radiographer and sometimes by the patient to minimize the radiation exposure. So, safety is always our first priority in radiology. Proper use of protective equipments ensure that the both patient and the radiographer remain safe. In a real examination, a patient is positioned so that the suspected area is centered on the cassette. The radiographer adjusts the X-ray and selects the appropriate exposure setting and also ensures safety. Once the X-ray is taken, the foreign objects such as glass, metal, and plastic appears bright white because they absorb more X-rays. So, when performing X-ray for detecting a foreign object, correct patient positioning is very important. The radiographer must ensure that the patient is comfortable, properly aligned, and still during the exposure. For example, in an abdominal case, the patient is positioned supine on the X-ray table and the center ray is di- directed toward the mid-abdomen. Good positioning prevents distortion and ensures the foreign object is captured clearly in the image. So once the exposure is made, the X-ray image shows the internal structures of the body. A foreign object usually appears as an abnormal opacity or shadow compared to surrounding tissues. For example, metallic objects appear bright while plastic or glass may appear faint depending on their density. By studying the X-ray image, radiologists can identify the shape, size, and location of the foreign object. This information helps in treatment planning and safe removal. X-ray is therefore one of the most useful tools for foreign body detection. Thank you. So, this demonstration helps us understand how X-ray plays a major role in diagnosis and patient management. Even though our setup here is for demonstration only, it gives a clear idea how radiographer handle equipment, maintain safety, and produce diagnostic quality images. The X-ray remain one of the most useful, quick, and accessible tools in medical imaging. Thank you for listening.